October is Breast Cancer Awareness Month, and according to breastcancer.org, around 1 in 8 women in the U.S. will be developing breast cancer at some point in their lives. It makes it the most common cancer diagnosed among women. Today, we're talking with Lindsey Causey with Cone Health Cancer Center at Wesley Long Hospital, getting answers to important questions about breast cancer screening and prevention as well. All right, let's just start with this. Why mammograms are just so crucial in detecting breast cancer?
That's a great question. Mammograms are incredibly important. They are the only test proven to help reduce breast cancer deaths. And it helps find breast cancer when it's most treatable. And that in turn leads to better outcomes.
Okay, and so we hear a lot of these medical terms thrown around all the time, like a 2D or a 3D mammogram. Let's talk about what the difference is and then which one is recommended and why.
So the 2D mammogram is the typical gold standard mammogram. That's when they take two images, they're from two different angles, and it's a two-dimensional image. Whereas the 3D mammogram, which is widely popular and covered by most insurances now, is a lot more detailed imaging. It's giving a three-dimensional image, and radiologists are able to see more parts of the breast tissue, and they're able to detect more invasive, smaller cancers.
Okay, so that's the difference between 2 and 3D. We're going to circle back around to that in just a minute, but I want to kind of talk about the age that women should start getting mammograms and then how often.
So recommend that women start getting mammograms at age 40 and go every year for their mammogram. Do not skip a year.
Okay, so every single year. This is one of those preventative tests that you can't do like once every 10 years. It really is once every year, and your beginning is at 40, which has been back down from a couple of years. So that may surprise you. Hey, you turn 40, you need a mammogram. All right, let's talk a little bit about family history and how that impacts breast cancer. What is that risk factor when it comes to that family history?
So family history, it's important that everyone know their family history and whether there's any cancer diagnoses, in particular breast cancer, because that can impact your risk. Additionally, breast cancer can be genetic related. That happens about 5 to 10% of the time. And so that means that you inherited a gene from one of your parents that increased your risk for breast cancer. And so it's important to know what yours is, because it may indicate genetic testing and, if positive, more intensified screening.
Okay, and so some people may say, well, I don't have a history of breast cancer, but there are other histories of cancer, some type of cancer in my family. Are there other types of cancers that may play into this?
There are other types of cancer that can play into it. And the biggest thing that I would recommend by women, by the time you turn 25, you really should talk to your primary care provider about your personal risk for developing breast cancer or any cancer, to identify if any additional testing is warranted or screening sooner.
Okay, we talked about, if you'll remember just a few moments ago, 2D and 3D breast cancer screenings. So usually 3D breast cancer screenings are for those people who have dense breast tissue. And so sometimes you're throwing around like, what is that? What does that mean? Let's just talk about what is dense breast tissue.
So breasts are made up of breast tissue and fatty tissue. And in the breast tissue, there's fibrous and glandular tissue. And so breast density just determines how much of the breast is fatty and how much of it is breast tissue. And it matters because it determines how well can the radiologist see through the images to detect cancer. Because if you have very dense breasts, the more white shows up on the mammogram. I like to tell my patients that it's like fog when you're driving through fog. And breast density category A, there's no fog. You're seeing through everything and everything's good. Whereas breast density category B, it's a little bit more, but you can still see very well. C, it's a little bit more dense and some small things might be obscured. And breast density D it's very hard to see, and you should consider additional or supplemental testing.
Okay, and how do you know if you even have dense breast tissue?
So they are required to tell you in your mammogram report when they send you your letter what your breast density is. That is law required by North Carolina. So that should be disclosed. And if you have any questions about that, you can always call your primary care provider and ask, or call the imaging center where you had your mammogram conducted at.
All right, and if you have dense breast tissue, what kind of mammogram should you get?
So dense breast tissue, depending on the degree of density, we would always recommend the 3D mammogram, but additionally, you can consider supplemental breast MRI.
So let's talk about this. Are there other maybe risk factors that we haven't talked about that we should be aware of when it comes to breast cancer?
There are. So some of the risk factors that can increase personal risk include age. As you get older, naturally, that is a risk that unfortunately none of us can avoid. Another risk is being overweight or obesity. So, trying to get your weight down to a healthy level is really important because that can increase your risk, especially after you've gone through menopause. Another risk factor includes not exercising. Then also smoking is linked to higher incidences of premenopausal or before going through menopause breast cancer. And so trying to avoid those risky substances. Alcohol is said to increase the risk in a lot of patients. There's no safe amount of alcohol that we know that can be safely consumed. So trying to limit any alcohol intake is key. There are other things that can reduce your risk, such as breastfeeding for at least a year. That is one that is important. And also, other risk factors can include hormone replacement therapy, and certain types of hormone replacement therapy can increase breast cancer risk. And that is important if you are taking that to talk to your provider about it to understand how that may impact your breast cancer risk and screening.
So there should be things that people at home should look for in their breast, like what changes should they be looking for that may indicate, hey, I really do need to go see my doctor.
Mm-hmm. Yes. And so the main things are any skin changes that can be dimpling or puckering or an indentation that you didn't notice that is new, nipple changes or nipple drainage. And by nipple changes, if your nipple normally sticks out and then it's all of a sudden going in or vice versa, that is an abnormal breast change that should be evaluated. And then a lump, a bump is obviously something that we want to look at. Another thing to bring to your provider's attention is if you have any swollen lymph nodes. That is important, and lymph nodes are under the arm. And so if you have any swelling or a new area of concern there, should bring it to attention.
Like if it's soft to the touch or like it hurts to the touch kind of thing?
So typically I say anything new or unusual that's persistent, you should have evaluated.
Okay. What are some of the biggest misconceptions that you're hearing from patients, either about mammograms or about breast cancer, that you just really want to set straight today?
So, biggest misconception is the amount of radiation exposure. The radiation exposure from the mammogram is very low. So, it really is important to get your mammogram. The benefit far outweighs the risk of any radiation received during that imaging. And then the second thing about breast cancer in general is that it's not a one size fits all diagnosis. And there's many different kinds and types. And so, the best chances you have to reduce your risk are to get your mammograms to have it be more treatable.
Every single year. Okay, and if someone's watching this interview later on and they skip their mammogram, what do you want to say to them?
Do not delay this important life-saving screening. I highly recommend that you prioritize your health and well-being and go and get your mammogram as soon as you can get an appointment scheduled.
Okay, and real quick, some steps that women can take to reduce their risk of breast cancer?
So, healthy diet, avoiding processed foods, simple sugars, and sweetened beverages and sweetened foods. Additionally, you should exercise. Really, sitting is the new smoking. Get up, get your steps in. Women who exercise 150 to 300 minutes a week have better outcomes than women who don't. And so exercise is really important. And then avoid those risky substances whether it's tobacco, limit alcohol, very important.
Okay. We appreciate your time and your expertise. And if you missed any of this, this is going to be in the To Your Wellbeing section of our website.